Namaha. First of all, I would like to welcome you all to join this program on the Sunday evening. And very happy International Women's Day to all of you. Truly speaking, it doesn't give me pleasure to celebrate this day, like celebrate a single day for womanhood, because every woman is capable of doing best of her work. Whatever she is good at, she can do it. And if she utilizes all her potential, she can just celebrate this day throughout her life. So every day in her life would be a woman's day. So that would give me more pleasure. Irrespective of that, since today we are celebrating this Women's Week, and the theme, the theme today is this year for 2024 is inspire inclusion. And when you say inspire inclusion, it means that you have to include each and every woman of the society, and it should be a big, a big group as such. So when you say count her in, it shows that irrespective, like you have to empower women in every facet of her life. So first of all, gender equality, as we keep on talking about, we can empower her through economically, like financial empowerment, irrespective of what the background she is coming from. She needs to be empowered. She needs to be considered. Each woman is important. So when we say about empowerment, basically we think, most of us think of, financial status, education, but not everyone think about empowering women through the health. It is very important that every woman should be, it is a birthright of each and every person, rather, that they should be healthy. Considering this, when we say women empowerment could not be possible without a proper health of the woman. So this Women's Day, let us pledge that we would be the first person to take care of ourselves, of our health. We should not wait for anyone to help us or empower us with health which we can earn on our side, because throughout the globe we see that whenever it comes to family responsibilities or our children or any other thing, women in the family is the first one to take a step back and neglect their own health. And now when we say health for a woman or empowering women with health, you cannot imagine women or woman health without the uterine health. So, like, even in my practice, when I see patients, when I talk to many female patients, may it be girls or working women between 2025 or in the elderly group, elderly women group, most of the time it is seen that people talk about mental health, they talk about physical health, they go visit a doctor for a regular checkup when it comes to cardiac health or any other things. But when it comes to uterine health or reproductive health, most of the time this health is truly neglected. People are not aware about true reproductive health. So what is basically uterine health? So we it is true that we cannot access or cannot have a look at uterus or uterine health very frequently. But what we do is we have an indirect method through which we can access or judge our uterine health. That is a menstruation period. So uh, this topic is not most of the time spoken about uterine health and menstrual health. So first, I feel it is very important that people should know what is uterus, what is uterine health, what is menstrual health, because what we see is it is just a small topic in your syllabus which has a 5 to 10 marks, and people study for that, and rest of all they don't know about it. So according to Ayurveda, what is uterine health or what is menstrual health? So, friends, uterus is a integral part or integral organ of a woman health, of a woman. This organ is there within the body right from the birth, but it is in dormant stage till the female attains the puberty. Once the puberty is attained, like this organ or uterus becomes functional. And when it becomes functional, it doesn't only function as a single organ in the body, but as you all know, that our body is like our body functions with all organ together in symphony. So all organ should be coordinating their functions with each other so that a body can function as a whole. You can't talk about a single organ and about single organ health. So when you see, say if you see when a woman girl attends puberty, there are physical changes, there are mental changes, there are emotional changes, there's change in the behavior, there's change into their looks, everything. So directly or indirectly, this uterus is has its impact on all other organs and overall body of a woman health, as it affects your physical and mental ability. Also, it is important that this menstruation or menstrual phase should be should be in a proper natural way. It is a natural process, and so it should function in a natural way. And so uterine health is important. So how if it like another question which I mentioned, how it affects your health. So whatever you do, like most of the time you must have seen, whenever there are problems with menstruations like delayed periods, heavy flow, or the periods like frequent menstruation, then it affects your body. Like there can be weakness, there can be lack of immunity, there can be mental irritation and whatnot. So it is very important to know that uterine health and menstrual health is an integral part of a woman health, and it should be taken care of right from the time the girl starts to know about the organ. So when we say about uterus, when since we are talking about uterus, we should also know what are the common health issues in women related to uterus. So there can be a number of other health issues in any particular woman, but when since we are talking about the uterus, so the common health conditions related to uterus, which we can see is PCOD, PCOS, wherein the ovulation doesn't take place. We'll be talking about this topic in detail. Endometriosis, wherein the endometrium is not formed in its right place, but other than internal part of the uterus, other than internal cavity of the uterus, it forms on the outer side. Then there are fibroids. Menstrual irregularities are very common. Like there can be frequent menstruation, there can be delayed menstruation. So when I see patients, I have patients who don't have periods for almost 6 months, and girls are fine with this. This is the most scariest part, because what they feel is uterus is only concerned with reproduction. It is only an organ for reproduction, but it is not like that. And so these girls feel that it is okay. I don't have to go through all these menstrual problems throughout, like every month. Even like working women, they are not aware of this thing. So menstrual irregularities are very commonly seen. There are ovarian cysts, hormonal imbalances which affect your overall performance at work, at family, everywhere. And then early menopause. This is one of the very grave situation which I see in many patients these days, but we can talk about it someday later. So, what Ayurveda has to say about this? So, according to Ayurveda, whenever there is impairment or like problems with uterine health or menstruation, there are Ayurveda classifies these problems or causes for uterine health in four factors. That is mithyachar, dushta artha, bija dosh, and daiva. So it mentions मिथ्याचारेण ताः स्त्रीणां प्रदुष्टेन आर्तवच जायन्ते बीजदोषाच्च दैवाच्च शृणुन्ताः पृथक्. So what is mithyacha? Mithya is wrong, achar is your behavior or conduct. So any conduct which is wrongly practiced, like diet, may be your diet, it may be your daily routine, it may be the way you eat your food, the time when you eat your food, the time when you sleep, anything which you consider into your daily routine and your diet, if it is not followed correctly, that is termed as mithyachar. And this can affect your uterine health or menstrual health. Second thing is Pradushta Artha. Pradushta is hampered. Artha is basically female egg, or we can say ovum, or like ovum itself. So whenever there is functional deformity in this ovum, like it can be not maturing of the ovarian follicle, or the follicle is matured but it does not rupture, or the ovaries are small in size. Anything related to menstruation and ovarian function is known as Pradushta Artha. Beej dosh is if there is any genetic problem in the ovum or ovary, or there can be problems with the anatomical problems with the ovum. Then this is known as beej dosh. Or if the there is lack of ovulation, it is termed as beej dosh. And daiva is fate. So Ayurveda classifies menstrual problems or uterine health in these four categories. So in Ayurveda, uterine health is known as Yoni Vyapan. So these are the basic categorization. Then what is it is important to know grossly. We'll first look at a gross thing about uterus and menstruation. So as I mentioned, uterus is the integral organ in any female body. So if you see, this is in this picture, there are parts of uterus. So first of all, this is vaginal passage. Then this is the body of the uterus and the uterine cavity. So this triangular shape is uterine cavity, wherein the baby or the fetus grows. This is the place, this is the lining of the internal part of the uterus, wherein the endometrium collects every month. These are the ovaries, and every month a ovum is released from this ovaries. This travels, so this finger like projection of the fallopian tubes, it catches that ovum, and then this ovum travels through this fallopian tube and enters the uterine cavity. So only if this uterine cavity, and when this ovum enters the uterine cavity, it gets implanted in the endometrium. Endometrium is nothing but the compressed blood vessels or blood which is collected in the uterine lining. So if the conception takes place, the fetus grows in this uterine cavity till the and stays there for the rest of the fetal period, followed by delivery. But if the conception doesn't take place, this ovum, then the body understands that there is no conception, and this endometrium starts shedding, and that is what we call as menstruation or periods. So basically normal cycle, so normal periods or menstruation is it should occur between 25 to 30 days. Whenever it occurs, it is a normal period. Sometimes in some cases the normal cycle can be of 40 days as well. But if the cycle is beyond 40 days or before 25 days, or suppose the cycle comes every 15 days, then that can be frequent menstruation, and that is an abnormality. Similarly, if there are no periods for more than 40 days, this is again another abnormality, that is delayed periods, and this is also abnormal. Now, many a times people think that okay, if there is bleeding for 1 or 2 days, it is normal. No, the bleeding usually lasts for 4 to 5 days. The flow can vary between these days, but 4 to 5 days bleeding is a healthy thing, which we can say at least 4 days. And during this only, ovulation takes place at around 13th to 18th day, anytime between this. So it can vary with individual, it can vary with the season, it can vary with the prakriti of the individual, and it can vary with the diet and your lifestyle as well. So this is known as and all this phase is divided into two parts. One is the follicular phase and other is the secretory phase. Now in the follicular phase, this ovum starts growing, maturing, and it ovulates. And in the secretory phase, if the conception doesn't take place, the menstruation, there is an onset of menstruation, and this is known as secretory phase. So according to Ayurveda, there are certain factors which need to be considered. So Ayurveda, according to Ayurveda, these Bija Rakta in the sense, the blood which nourishes this Artha Dhatu or nourishes this ovum or Shukra Dhatu in women is known as Artav Dhatu. So the blood which nourishes this Artav Dhatu is known as Beech Rakta. This is sucked in and an endometrial lining is formed inside the uterine cavity. Now, whenever you take some food, this is converted into Ahara Ras, and then this forms helps you to form the Rasa Dhatu, which is the first Dhatu um, in any body, living being. So, Rasa Dhatu is the basic Dhatu, and the dependent Dhatu on this is Raja Dhatu. So, Raja Dhatu, Raja is the or whatever we call as endometrium or Bij Rakta is the Upadhatu or subtype of this main Rasa Dhatu. So I think you can have an idea that whatever you eat is very important because that is what is going to make up for your Rasadhatu. And this Rasadhatu is only going to nourish your Bija Rakta or your ovum or whatever you call as the process of menstruation in simple language. So this Rasadhatu will only help you to form this endometrial thickness. So if there is conception, it will also help to nourish the fetus. But if conception doesn't occur, as you all know, that the uterus is the organ which is in the lower abdominal area, which is governed by Apan Vayu. And if the conception doesn't take place, this Apan Vayu gets activated and menstruation begins. So this was an Ayurvedic perspective, how menstruation initiates. So what happens is this was about what we called as normal cycle or normal how menstruation works in a female body. So what happens in PCOD? So in PCOD, so this is a normal ovary and this is a um, polycystic ovary. So what happens in PCOD is in normal ovary, as I mentioned, that each one ovum from each ovary, like alternate ovary, starts maturing every month. And when it starts maturing, after attaining a particular size, it bursts out. So ovarian follicle is ruptured, ovum is ruptured, and the process goes on. What happens with PCOS is this ovarian follicle doesn't mature or it doesn't mature completely. It remains immature. And so it cannot rupture. And what happens is it ends up forming a cyst. So ovarian follicle does not rupture and so it ends up forming a cyst. Now, when this process goes on, the hormones are activated. So it is known as HPO axis, hypothalamus, pituitary and ovarian axis. So all these three hormones work in sync. So if this endometrial thickness is not formed and the HPO axis is not activated, what happens is excess of male hormones are secreted, that is testosterone, and this results in various symptoms like facial hairs, hairs on your face, hairs on your back, and like hair loss and everything. So male pattern is masculine hormones increases, and this leads to hampering of ovarian function. So this is what happens in polycystic ovarian disease. So this is there's a lot more which I can talk about this, but to keep these things easy, I'm just explaining you in short. So according to Ayurveda, if we see which dosh and dhatu are involved in PCOD is the Bij Rakta, as I mentioned, that is Shukra Dhatu in females, that is known as Arta or Bij Rakta, which forms the endometrial thickness, endometrium as such. Vata dosh helps, like Vata dosh has a different varied role to play. First of all, to carry the ovum from the, catching the ovum by the fimbrial end, taking it through the fallopian tube, implanting it in the this endometrial cavity is also the role of Vata dosh. Rupturing of the ovarian follicle also depends upon the Vata dosh. If the conception takes place, to hold the baby is also responsibility of Vata dosh. And if the conception doesn't take place, menstruation or menstrual flow is also governed by Vata dosh. So if you see, Vata dosh is very important when it comes to uterine health. Then Kapha dosh, what happens is Kapha dosh is one. If Kapha dosh is excess, it blocks the Artava Srotas or it doesn't allow the ovarian follicle to rupture. and it leads to cyst formation. Again, Rasa Dhatu, I've already mentioned, it is the first Dhatu which takes, which regulates everything, formation of endometrium, nourishment of the endometrium, everything. Then Medha Dhatu, Shukra Dhatu, or Artha, and Artava Srotas. Artava Srotas is basically a system, you can term it as a reproductive system or uterine organs. All uterine organs in together, all together form Artava Srotas. So basically, according to Ayurveda, Srotas is a channel, or as you call, system for each, you know, each system, like each function. So as you, like if you say reproductive system, it is Artava Srotas. If we say blood tissue system, then it is Raktava Srotas. If you say urinary system, then it is Mutrava Srotas. So there are 13 Srotas in your body. So Artava Srotas is one of them. So this is what a PCOD is about according to Ayurveda and in general. So now when we hear a lot of terms like PCOD and PCOS, so many of them are confused with what exactly is PCOD and what exactly is PCOS. Is it, or sometimes there's a confusion that both of them are same. They are not actually same, but some certain symptoms of them are same, which make us think that both of the situations are same. So basically, PCOD is a well formed disease. So it is a polycystic ovarian disease. So it is an established disease, whereas PCOS is a syndrome. Now, syndrome is group of symptoms. So PCOS is group of symptoms which mimic PCOD. What happens in PCOD is PCOD there can be ovulation, but sometimes eggs or ovum are not completely mature. They can be immature ovums, and this is mainly due to lifestyle, due to your dietary habits, and many more things. We'll be discussing it later. Whereas PCOS is mostly due to metabolic disorder. And this specifically leads to anovulation or anovulatory cycle, where ovulation doesn't take place at all. And that is the reason females with PCOD have fertility issues. Because endocrine system, hormonal imbalance is totally disturbed in PCOS. Whereas in PCOD, things are under control. The hormones have imbalance, but we can surely correct them. And so we see in many cases of PCOD, they're like people, in many females with PCOD, they're able to conceive. But mind it, we can prevent both of these things, or we can help ourselves only if we can correct the lifestyle or routine, whatever we follow. So we've seen now, when we know the difference between PCOD and PCOS, still treatment line goes because when we come to Ayurveda, there are certain, as I discussed, Mithyachar, Pradushta, Artha, Bija Dushti, and Daiva are the 4 factors. So we have to consider those factors when we are treating PCOS or PCOD. So there are certain lifestyle, so we should know what are the cause behind this. So lifestyle truly impacts uterine health, as we discussed. So certain things which we all neglect to do, or we unknowingly end up into our comfort zone, and then follows a certain lifestyle which is really of concern, which needs to be taken care of. So first of all, sedentary lifestyle, wherein I think everybody is at their desk on computers for like most of the time throughout the day. Physical exertion for work or exercise is not so much unless you really focus for it, or unless you have a problem. So sedentary lifestyle is something which is a main cause behind PCOS. Then, I'm sorry, altering eating habits. So whether if you don't eat on time, or you're not having a nourishing food, you're not having healthy food, you're having processed packaged food or junk food, if you encourage this, then it is bound to take you to a condition like PCOS. Another major concern, like which is not in our hands majority of the time, that the crops or the food which is grown has they are grown chemically, or there are a lot of use of chemical pesticide, chemical uh, fertilizers when they by the farmers who grow the food. So this is one of the major problem. Again, hormone induced food. So many of the times cattles are injected hormones, there are hormones injected in poultries, and that is one of the reasons which is ultimately leading to hormonal imbalance in the people who are consuming them. So this is something. So there are solutions. We can shift to organic or natural foods, but this is one of the concern cause behind uterine health. Hormonal pills and painkillers. So hormonal pills, when you say there are a lot of hormonal pills taken by females, um, but then mostly working females, because they have some meetings, they have some festivals at home, they have some spiritual things at home, or they have to travel somewhere, and when you play with the nature cycle, it is bound to affect you. So many people, many women, they have the habit to either delay the periods, or bring it very fast. So whenever there are patients who ask me at my clinic that which tablet should I take to delay my periods? We have a function at home. And then I say, please don't do that. So you'll take tablets right now, and then you'll delay the periods for a time being, but then they would be either delayed for a long term, or they would be hardly impaired, like highly impaired. So hormonal pills or oral contraceptive pills are also not a solution for uterine health. Painkillers, especially painkillers when they are taken during dysmenorrhea, that is pain during periods. If anybody has the habit to take painkillers, this can again cause a problem. The reason behind is when you take the like whenever there is a menstruation occurs when uterine muscles contract and relax. So there is a contraction is the need for the proper menstrual flow. What happens with painkiller is they relax your muscles, they relax your uterine muscles and reduce the contractions. And that is the reason the pain is relieved, but the uterus is not cleansed properly. Whereas with Ayurvedic medicines, or if you consider regulating your vata dosh in the uterine area, there will be no pain, and the menstrual flow will also be correct. Tight clothing and driving. Driving, when I say, I mean two-wheeler driving. Most of the time it is two-wheeler driving. Tight clothing, so as all of you know, like uterus is situated in the lower abdominal area, which is governed by vata dosh. Again, the important thing is female body is heat dominant, ushna in nature. Because Artha itself is Ushna in nature. So when we know Soma Tattva and Surya Tattva, female body is Surya dominant of Surya Tattva, that is heat. And when basically you use very tight clothes like jeans or any tight clothing around your waist, it increases heat inside your body, and again it hampers the uterine function. Similarly, when you drive mostly on two-wheeler, there is a lot of vibrations, and when uterus is not an organ which is complete, like very much fixed. It is slightly movable, either upwards, sideways, downwards. So this can lead to anteverted uterus, retroverted uterus, and this is the one of the reasons for the pain or problems with the vata dosh and menstrual issues. Stress is one of the very common issue. Again, constipation. So as I told you, apan vayu is the one who governs movements in the lower abdomen. May it be menstruation, may it be constipation, sorry, bowel movements. So if your bowel movements are hampered, this affects the movement of apan vayu, and then again it affects the menstruation. Again, staying awake at night, smoking, alcohol, or uh, like not following the circadian cycle is again one of the reasons behind menstrual issues. Important thing is violating Rajaswalacharya, Garbhadi Charya, and Sutika Paricharya. These are the women specific charya. So as I mentioned, charya is whatever you do in your daily routine, whatever things like you eat, you sleep, you work, you drink water, you pass your motions, whatever things you do, there is a recommended protocol for the things you do, and this is known as charya. This is your habit, and these habit form your health. So Rajaswala charya is menstrual code of conduct. Rajaswala is a phase in a female life when she is menstruating. And this charya, if it is not followed properly, or garbhini is antenatal care or pregnancy routine, whichever is mentioned by Ayurveda, if you don't follow that, it is surely going to lead to uterine health issues or problems like PCOS. And Sutika Paricharya. Sutika is post delivery. So, Sutika Paricharya, so code of conduct after delivery should be at least for 45 days. This is the time duration. So, these 45 days, it is very important that you follow all the practices mentioned in Ayurveda. So, if you violate either of this charya, especially Rajaswala Charya, Garbhini Charya, and Sutika Paricharya, it is going to hamper your uterine health and your menstruation. And minded that PCOD is not a disease which would affect only among girls, but it affects right from throughout the menstrual reproductive age, mostly right from the menarche to around 30-35 years of age. Anybody of us can have PCOD, and PCOD is so prevalent that if you see 10 girls or 10 females, among them 7 to 8 females have problems related to menstruation or have problems like PCOD. Sorry, it must not necessarily be a full blown PCOD, but symptoms, either of the symptoms of PCOD. So following Rajaswala Charya is very important. So in short, let you know what is Rajaswala Charya. So basically, we see many ads that it is okay, like especially sanitary pads ads, that it is okay that you should, play your game, you should indulge into your sports, you should be fit, and you should be working in throughout the your periods. It is your right, and only then you can attain your gender equality and everything. No matter what it is, but femininity or being a woman is a blessing, and a woman can only be a woman if she takes care of this femininity. So no matter how busy she is, how workaholic she is, she can surely take care of this phase, which is really going to help her work for the longer span of her life. So first of all, it is very important to take adequate rest. When I say rest, it is doesn't mean that you have to sit at a place and sleep or don't do anything, but you can have, or you can follow certain basic movements or basic things you can do which won't exert you, or which won't make you indulge into strenuous work. So I see many of the patients, they go for a regular workout during periods, and this is a very wrong practice, because it totally disturbs your menstrual flow. It totally disturbs your vata movement. So imagine a scenario: if you have a small cut on your finger, what you do is you unknowingly tend to protect that finger, because you shouldn't touch it, you shouldn't further injure it, or the wound shouldn't be very big. You consciously take care of that finger. So when your organ is bleeding, it is very important that you let the organ heal, because the endometrium is shedding. It is very important that uterus needs rest, your body needs rest. So taking adequate rest during periods is important. Now these days there is a lot of awareness being created among people. So females have menstrual leave, they are allowed to work from home, and then we can really resort to such kind of practices, like we can work from home or do any, like if everybody has a way to manage their work. So adequate rest is more important. Then warm, freshly cooked food, and basically it should be easy to digest. So what we suggest is having a lot of ghee, milk, dal, rice, or soups in your food, which would be warm, which would be easy to digest, which can be tempered with either cumin seeds, asafoetida, or ginger. So that will help to alleviate vat, that will help to regulate the vat movements and pacify vat. So it won't cause any pain, or it won't cause any dysfunction in the uterine bleeding. Again, herbal decoctions, so there can be decoctions made with methi seeds or asafoetida, or herbal herbs like dashamur. This you can surely take during menstruation, which would again help to regulate vat movements. Hygiene is one of the most important thing which should be taken during menstruation, because so I find girls who don't change their pad for the whole day sometimes, or they don't clean the private parts properly, or they work in a very unhygienic area, and all this can lead to infections, or all this can lead to impaired uterine health. Another important thing is, it is suggested in Ayurveda that you shouldn't scrub or bath during this period. When they say bathing, it means you shouldn't scrub your body hard while bathing during these periods. So we see, because your body is all set to cleanse. Um, as I mentioned, that female body is dominant of heat, and your body helps to cleanse the toxins. We are blessed in a way that your body helps to cleanse these toxins, remove this heat from your body during this menstrual period. And when you bath, or when you scrub really hard, again this bath is disturbs, and it can lead to skin issues, skin problems. It can lead to dry dull skin. It can lead to heat accumulation into your body. And when you have a head bath before fourth day, I'm sorry, I can't give you the exact logical explanation behind this, but it has been observed that whenever you take a head bath just before the period starts. Or in between, if you take a head bath when the period starts, the menstrual flow reduces. The flow becomes scanty comparatively. And if this happens, uterus doesn't cleanse properly, endometrium doesn't shed properly, and then this can lead to other health issues which are related to uterus, or any blood impurities. Okay, so you can have acne, you can have dandruff, you can have some rashes on the skin, or not immediately, but it can be a long term thing. So if any of the friend, or if any of you if you are visiting parlors, especially for a facial or for a body massage during menstrual cycle, please do not do that. Important thing is avoid physical intimacy. And I would also say, many of them, I've been asked by many of the patients if masturbation is allowed during this period, but I would strongly well, I would strongly refuse to follow either physical intimacy during menstruation, because this is what your menstrual charya or your rajaswala charya is, what is going to affect your uterine health or your uterine function. So similarly, as Rajaswala Charya, there are so many Charya which I mentioned. That so there is Sutika Charya, there is Garbhini Paricharya. Similarly, there is Ahar Charya, about the code of conduct, how we should eat. There is Swapna Charya or Nidra Charya, Ratri Charya, that comprises of your sleep. There is Dinacharya or daily routine. So if you have to check how good is your Charya, we at Charya Ayurveda, we have designed questionnaire. This is a data driven formula, based on the srotasas, dosh, dhatu, and mal of your body, through which, if you fill up the questionnaire, at the end you can get to know what is your health score, or what is the score of your charya, how good is your charya, and how it can impact on your health. And further, it also generates a report where it gives you the remedies, what you should really correct in your daily lifestyle. So you can surely try know your charya. You can check it out on charyaayurved.com. Coming back to PCOD, so common symptoms of PCOD, what you can say, as I mentioned, is irregular periods. Irregular periods, that means periods can be either very delayed. I have patients who don't have periods for 9 months to 10 months. And then after 6 to 7 months, there's a flash of light, and they start, oh, didn't have periods for 7 months, and now I have to do something. And then they expect that these periods should start in next 1 month. This is not going to happen. If only if you take care of your health, your periods would be in sync with your nature. Then sometimes the periods are very frequent. This again depends on what dose type you are, or what your body is going through, your lifestyle. Sometimes the flow is like, periods are regular, but the flow is very scanty. Then important thing in developed PCOD, or I would say rather PCOS, is unwanted facial hair. So there can be hair growth on your face, along your earlocks, or like mustache or chin, and this is not which gives a, you know, comfort feeling in that girl or lady. Then again, the skin becomes very dry, so the pore size increases. There is a lot of acne or pimple, darkening of the skin, especially at the neck area. If you see, the neck area is gets darkened in patients with PCOS. This is one of the I could say examination criteria which we generally follow in our practice. Pain during periods or weight loss. See, many of the time, majority of patients with PCOD gain weight, but there are very few of them who don't gain weight or they lose weight. So this percentage is low, but most of the girls they've gained weight. Then there is Huh. Then there is acne, like girls become lazy, they don't feel like doing anything because obviously they also they start getting an inferiority complex, so they avoid going outside or mixing in the group. And then there lies the hair loss, irritation, mental stress, mood swings. Because the hormones are disturbed, all these the symptoms set in. Mhm. Now coming back to treatment, when you, according to Ayurveda, when you have to treat patients with PCOD, as I mentioned, nahi vatadrute yoni narinam sampradushyati means any uterine condition, according to Ayurveda, doesn't exist without involvement of Vata dosha. So, right till as of now, also I've explained you how Vata dosha is important for governing the uterine cycle, for governing the menstrual cycle. So, when we have to treat PCOD, basically there are two types of classification. First, as I mentioned, lean PCOD, wherein the weight there is a weight loss or there is no weight gain rather, and the other one is obese PCOD, wherein there is a lot of weight gain. So I have patient, I've seen her a few days back, and um, she gained almost 15 kgs in last 3 months. And the reason was PCOD. And again, there were all lifestyle issues because she had to study, she used to stay away for late night and whatnot. Then, many of the times, it is common that delayed periods are noticed rather than frequent menstruation in PCOD. So, when we say delayed periods, most of the time, it is seen that people go for tablets which would either regulate their hormone, and there is withdrawal discharge, and they feel that periods are like the periods have started. But it is not like that. Or otherwise, most of the times they take some pills so that periods will start. May it be Ayurveda, may it be allopathy, or may it be homeopathy, anything. People often go for the practices कुछ भी करके periods चालू होने हैं. This is not possible. Now, as I mentioned you in the beginning of the session, that endometrium starts growing in the uterine cavity. So this is your from the Rasadhatu, the uterus sucks the Bija Rakta inside the endometrium, uterine cavity, and endometrium is formed. Now, generally, this endometrium thickness is up to 12 mm, 14 mm, whatever. Like, unless this thickness is not achieved, your period doesn't initiate. What happens in the case of where the endometrium is thin? Many patients I've seen that despite there are no periods for last 7 months, 8 months, endometrial thickness is hardly 5 mm, hardly 8 mm. Then if there is no endometrial thickness, what will the body shed out? Because there is lack of nourishment, or women, they don't eat properly. There is no there is like rasadhatu is not healthy, rasadhatu is not formed, so there is no endometrium formed in the uterine cavity. This is the problem. And here we have to consider nourishment treatments. So, wherein the body would be nourished, wherein the uterus would be nourished. Whereas there is another condition where the endometrium is well grown. Endometrium is thick, 15 endometrial thickness, 20 endometrium thickness, but there is no period for last 3 months. Now here, as I mentioned, Vata dosh is important factor in menstruation. What happens here is there is a problem with the movement of Vata. Here you have to treat Vata dosh, and only then this flow or menstrual flow initiates or menstruation initiates. So when we consider managing PCOD with Ayurveda, these all factors should be considered. First of all, lifestyle modifications, diet modifications, then comes your medication and Ayurvedic Panchakarma. Panchakarma are five types of therapies: Vaman, Virechan, Basti, Nasya, and Raktamokshan. Now, these treatments or these therapies, they help you to detox, in, like, if I have to say in short. But what it really does is it balances the internal humor, it balances the internal dosh, and it cleanses the body. It cleanses all the dhatus, it cleanses and replenishes or rejuvenates your body. So these are the four folds through which you can treat or manage PCOD. So as I mentioned, like here we all are to understand what should be the dinacharya or what should be the regular routine in PCOD. First of all, consistency is the key. When I say consistency, I mean that it is not, magic is not going to happen in a single day or a single month. It is not that you follow certain routine for 1 month and your periods are going to be all set and perfect. You have to keep this practice, you have to follow correct lifestyle throughout your life. Only then things can be in place. Because you've spent so many years disturbing the nature cycle, you'll also have to spend at least few months to correct this cycle. So lifestyle modification. Lifestyle modification is all small things that you do. So when I say it is just following the natural rhythm, the nature clock, biological clock. Right time to wake up, right time to eat, right time to sleep, right time to work out, everything. So they should be on time. The other day I had a girl. She was in a 12th standard, and I like she had come for PCOD. She had a lot of acne. She had some skin issues also. And then when I asked her like too many things, and she was like, "No, no, I don't have any junk food. I'm good at things and everything." Then I asked her, "What about your sleep? When do you sleep?" She said 4. I was like, "Do you sleep at day?" She was like, "No, no, no, I sleep at 4 a.m. in the morning." I was like, "Why? This is the time you should wake up." And then she was like, "No, I'm used to studying at night." I was like, "That is fine. Studying at night is okay. But if you're studying till 4 a.m. and sleeping after 4 a.m., you're totally going against nature and you're hampering all of your lifestyle, like all of your health." So instead, sleep early, sleep by 10, wake up by 3, wake up by 4, or wake up by 3:30 is fine. You start your day early. That is a good practice because we have to, for our nature clock totally depends on the sun. So they should start before the sun rises, and that is the ideal time. So following the natural cycle, circadian rhythm is very important. Then clothing, as I mentioned, tight clothing can be a problem. So at least clothes around the waist should be loose fitting, or if you're wearing tight clothes, it should be for a certain time duration. You shouldn't extend, like, wear it regularly. Some days it is fine, other days you make sure once you are at home you use loose clothes, or which are not very fitting clothes, which are comfortable. Then cultivate good eating habits. So here eating habits, when you, it can vary. So right time of eating, right way of eating. So you should sit at a place, sit with all your senses towards food, eat freshly cooked, homemade food, avoid packaged food, preserved food, extra salted food, and most importantly, have seasonal food. Regular exercise that is focused on lower abdomen. Whenever I won't suggest strongly about heavy workouts or weightlifting that you can do as per your things, but when it is considered concerned with uterine health, you should focus the exercise which would help your lower abdomen. Many of them, if you look into, and if you check about your old practices, or if you think about your the routine which your grandma or your grandparents used to follow, what used to happen is all the ladies in your house, like, what I remember is my dadi, my nani, what they used to do whenever they used to sit, they used to sit and do the work. If they are near a gas or stove or a chula, they used to sit with in a squatting position, or a foot close to their uterus, like they'll fold their legs, and one leg used to be close to their abdomen. Now what happens is that they indirectly protect your uterine things, uterus as an organ. So they used to work in a squatting position. They used to roll their rotis when they like whenever they used to be in kitchen, they used to sit and perform the work. They used to clean the house. They used to have a small broom, and then they used to bend from their lower abdomen and then sweep the entire house or swipe the floor. Whatever they used to do, there was lot of sitting down, getting up, sitting down, getting up. So during this process, there used to be ample amount of blood circulation in and around the reproductive area, or around the uterus. Like again, there would be practices like taking out water from the well, or traveling for long distances, everything, wearing bangles, applying kumkum on the forehead. That used to be usually dry powder, because this is the sapani marma. This is the marma where if you, and there's Agnya chakra also here. So if you press this, this is the point where, which activates all these marma, like bang this, there's another marma over here. Then they used to wear this bichwa, or in the toe rings. So all these things, they used to take care of your uterine health. So all our practices were around the uterus and uterine health. So this is something. Again, attending natural urges is very important, especially motions, menstruation, and urination. So these urges, again, are governed by what. So if you hold these urges, there can be uterine problems. So regular exercises, stress relieving practices, kadha for regulation of apanvayu. Now this kadha can have dashamur, this can have asafoetida, this can have chaturbij, or many such medicines, or you can have a ready-made kadha. Then practices like nasya, that is instilling nasal oil or ghee into your nose. Nabhi puran, that is oiling your belly button, is also important, because this helps blood circulations towards uterus. Again, as I mentioned, sleep timings and panchakarma. Then diet. So as I mentioned, regular meals. Again, many of the girls, they have the habit to have dry food. There is lack of moisture, there is lack of ghee or oil in the food, or very dry, they have only roti sabji or only breads, which do not have much of moisture content in their food. And so it is important to have either a bowl of dal, buttermilk, juice, rasam, or anything into your diet on a regular basis. Then, instead of chemical or hormonally grown food, naturally grown and seasonal foods or organically grown food should be preferred. Again, important thing is, these days there is a lot of hybrid foods available in the market, or we tend to, for ease of making or eating, we tend to have seedless foods. Now when you compare, as we say, whatever is there is in your nature is in our body. That is, your body is a miniature of nature. So if you if you're having, imagine if you're having seedless food, and your ovum is a seed, is a human seed. So if the food which you are having doesn't have any seed, or if it, even if it is has seed, that seed does not have the capacity or ability to regenerate any new life, how can that food nourish us or our reproductive organ? So avoid having seedless foods like seedless papaya, seedless fruits, seedless black raisins. Instead, have foods which has seeds naturally, like pomegranate, papaya, or any foods which has seeds. Avoid seedless food. Juicy, for having juicy fruits is equally important. Again, as I mentioned kada, we also have sukhada kada, which is a dip and drink kada, ready to make kada. Then one important thing is, you can also, as I mentioned, seeds are important. There are certain seeds which you can include in your diet, like garden cress, fenugreek seeds, fennel seeds, carom seeds. Now you can make a mukhwas or digestive churn with this seeds, and you can have it post your meals both the time. But for proper digestion, it is advised to have turmeric, garlic, cumin, or ginger in your diet. So these are hot in potency. This not only regulates what, but also are good for menstruation, and also are good for ovarian development. And weight should be strictly managed. But I strongly advise not to go for crash dance, because that can be a disaster. Again, Panchakarma, as I mentioned, Vaman is treatment in which we give medicines and then give a vomiting medicine. Virechin is where we tend to, go give purgation therapy. Bast is a method similar to enema, but oil or decoction is used to give this medicine. This regulates Vat. Nasya is nasal drops, and Nabhi Puran, Abhyanga, like body massage with oil, and Shirodhara is very important to maintain this dosha balance. Next, coming to herbs for PCOD, there are many herbs which you can use depending upon what the type of PCOD is. As I mentioned, lean PCOD, obese PCOD, where the endometrium is thin or endometrium is thick. Depending on that, you can select the herbs only after consulting your doctor. So Dashamur is something which works on Vat and which regulates Vata movement. Castor oil is helps you in various things. It again helps to govern Vata dosh. So it helps for the ovarian rupture also. Sorry, I mean follicle rupture. It helps to regulate the menstruation. It helps to regulate the apan vayu. Then Anantamur and Manjishta are the drugs, herbs which helps to form, strengthen your bija rakta, which helps to for the formation of endometrium, which helps to maintain fluidity of the blood, fluidity of the menstrual flow. It helps to regulate the menstrual cycle. It helps to, prevent clots, or prevent viscosity in menstrual flow. Then Chaturbij. Chaturbij is four types of seeds, as I mentioned: fenugreek seeds, garden cress seeds, ajwain seeds, and then fennel seeds. These four seeds together help form Chaturbij. Now, these helps in ovarian functioning, formation of ovum, initiation of menstruation, then formation of endometrium, proper health of ovaries, proper flow of, proper movement of ovum from the ovary to fallopian tubes and into the endometrial cavity or uterine cavity. Shatavari nourishes Rasadhatu and also nourishes Rajadhatu, that is the Upadhatu of Rasa. It helps in formation or nourishing the endometrium. When I said that thin endometrium is a problem in many cases, in that case, Shatavari is a very good thing, which will help you nourish or increase the endometrial thickness. But if the patient is again obese and if there is a lot of arm formation, you cannot use Shatavari. That is the reason you need to take a proper consultation from an Ayurvedic doctor and then use these herbs. Aloe vera is again, it has a Vedan property, so it helps to cleanse the uterus. So there are timings when during the cycle when you should use a particular herb. And turmeric, as all of you know. Exercise, as I said, is very important. And it should be on a regular basis, at least 5 days a week, at least half hour a day. So there are a lot of exercise. Simple Surya Namaskar can help. Yoga postures can help. Swimming can help. Whatever can give you proper functioning at the like improve blood circulation on the lower abdomen is suggested. As I mentioned, old practices which are dadi, nani, or mothers used to follow. These practices hold very much importance in uterine health. I think in India, especially in Maharashtra, we have a function during Savan Mahina, Savan Mas. It is known as like newly wedded, um, female. She has a puja known as Mangala Gauri, and there are a lot of games played during those days. All these games, there used to be a social gathering, and all these games were focused on the uterine health. So if you get to see like if you search on Google, you can search Manga Gauri games, and those include all those things, practices, all those games involved. So these are the practices which you can follow in the way of exercises. Dance is one of the good form where you can involve your lower abdomen. So coming back to yoga, Surya Namaskar or sun salutation is a complete form of exercise. Sarvangasana helps to regulate your hormonal balance. It helps to again control your hormones and dosha balance. Paschimottanasana, Malasan is a squatting position. Now, squatting position is the pose which is very important for your uterine health. So you may use it in any form, like into your daily practices. Whenever you can use this asana as a asana or as a practice. Then Bhujanga Asana, Chakki Chalanasana. Chakki Chalanasana is typical thing when in olden days when the ladies used to grind the atta, or like grind the grains for making atta. It is, they usually used to spread their legs and then rotate the chakki. So this is the proper thing wherein the rotations used to takes place at the lower abdomen, and your uterus becomes flexible. There is a lot of blood circulation concentrated at that area. Naukasan, Chakrasan, butterfly pose, Pranayam and Kapalbhati. Now, Pranayam and Kapalbhati should always be done only under the guidance of an expert, or you should learn these practices from an expert and only then follow. So when you combine, see, PCOD is not a thing which can be cured within a day. It is very important that you follow regular practices, follow your day, like correct your daily lifestyle, or follow exercises, and importantly, follow your proper diet. Diet, as in, again, I would like to mention, it is not about crash diet, it is not about losing weight, it is about having a nourishing diet which will include all the six tastes, which would nourish you as a whole and your reproductive organ, and then your uterus would be able to function normally. It will, there would be regular menstruation, proper flow without any pain, without any clots, flow for 4 days. And this would not only, I like people when they say that uterus is important for reproduction, because most of the times this topic or menstruation topic is considered as taboo or is not properly discussed with the girls from the elderly people or in the family. So it is a very important topic, very important thing that everybody should, be vocal about it, and you should be aware that you need to take care of your uterus. Your menstruation is not only for reproduction, but it also takes care of your dosh ball balance, your hormonal balance, and your daily day to day regeneration, rejuvenation of your body. As I mentioned, shukra dhatu in your females is artav, or is what you can compare with menstruation. Shukra Dhatu is not only responsible for reproduction, but reproduction at every point in your life, because there is a regular wear and tear going on in your body at a microcellular level. All these my cellular like at all these levels, there is a regeneration or reproduction at every moment. This is what shukra dhatu, or this is what artha dhatu is responsible for. So apart from reproduction, your overall regeneration of your body, timely regeneration of your body, I can say, every moment is what takes care, is what is taken care by your artav dhatu, and that is nothing but your reproductive system, your artav srotas in female body. So with this, I would end and take that.
Thank you, Shweta. It was a beautiful, beautiful session. I just can't imagine that so many small habits, activities, tips given by our grandmothers, mothers had so much of influence on uterine health. So I'm so grateful to you for this entire session. Friends, we have these two different products by Charya Ayurveda, Sukhada and Nari Charya. Please, Vedishweta, why don't you explain a bit about it as well?
Yeah. So these are the two products for uterine health. So we are basically working with into this segment of women health. So I know that whenever any, especially being an Ayurvedic doctor, we focus on churna and kadha. And most of the time there is a perception that churna and kadha are not very palatable, and I don't have time to make kadha, or I stay outdoor, like not, I don't stay at home, I stay in a hostel and I don't cannot take kadha. Or another thing is, I cannot, even if I make the kadha, I can't carry it. So what we've done is we have made the kadha properly with the herbs, then we have packed it into granules, And then these granules are packed in tea bags. So on the go, you can carry this sachet anywhere, at your work, at your school, at your office. Just what you need is a half a cup of water, warm water. You can dip this tea bag into the hot water, and your kadha would be ready. Like fresh kadha would be ready. It won't be a stored kadha, but this granules would disperse in the water and they will form a kadha. Now, Sakhuda is for menstrual well-being, wherein it would take care of regular vata regulation. It would help in, relieving menstrual cramps. It would help in regulating vata and regulating menstrual flow, and automatically it would help to some extent PCOS like conditions. Then Naricharya is a vaginal wash. Most of the vaginal washes which we get in market are foam based or are chemical based, which can generate foam. But as I mentioned, we take care of our pain when we have pain and like headache, abdominal pain, or if there is a cut or wound or swelling on the external body parts. But when it comes to uterus or a cervical area, which can have ulcerations, which do have swelling at times, which has pain in the cervix, there is pain in cervical area. At this time, when when you use warm kadha for a vaginal wash, it relieves all these problems. It regulates what at that area also, and cleanses the cleanses the vaginal area, thus preventing from infections or any menstrual unhygienic conditions. So these are the two products. You can try it. They are available on our site as well.
I think, friends, the body awareness is very, very important. And I always say that don't wait for the symptoms to appear. If you have if you feel like that there is something happening which is not correct, or if you feel that you just want to get yourself checked. So for that, before switching to any kind of diet or any kind of regime, just visit Charya Ayurveda website and try to find out what is your correct Charya score. And as soon as you will complete the set of questionnaires and you'll get the Charya score, you'll be able to have a remedies or the solutions provided to you. Just try adapting those solutions in your daily life and see if it is working or not. And then take the second step, reaching out to the Ayurvedic Vaidya or reaching out to any other person in the preventive care or in this holistic well-being system. But before that, visit Charya Ayurveda. That is just a suggestion to you all. We have already shared the website of Charya Ayurveda. We are sharing different kinds of products also. That's the website, www.charyaayurveda.com.